Okay, thank you for being here again on a different video. So I will be continuing on the topic of the coronavirus epidemic and what are the lessons for my own patients in my clinic. So for the general public, when you're trying to make workplace deadlines happen, for instance, even if you are working from home these days, as we are seeing here in different forms of industries like the consulting industry, the IT industry, we are able to work from home on a computer. I'm sure there are deadlines that are present. You are actually trying to find a balance between desires to finish and trying to get a good feedback from the company versus maintaining a discipline towards your biological clock, which is, are you able to eat on time? Are you able to wake up in a timely basis? Sleeping, eliminating, trying to delay elimination just because you have to try to get things done, walking and cleaning. And these happen and also frequently in our own healthcare professional, because we are trying to finish ICU rounds. And sometimes we just realize that we've been walking around for 2 hours, 3 hours, and have not had time to take care of our nature calls. So when one disrespects the health of the microcosm within oneself with delays in this circadian rhythm or biological clock, including night shifts, for example, the natural forces called Vata, Pitta, and Kapha. This is something that I think the world is going to have to understand from here on. And maybe we'll probably have English terminologies for these natural forces very soon, because Ayurveda is being appreciated and understood better in the Western world these days. So the dysregulation of the forces that live in the core of our gut accumulate over time and manifests as a disease. This is actually well understood. Initially starting as asymptomatic or subtle, stage 1 and stage 2 of a disease per Ayurveda. The dysregulation, or vikriti we call it, spreads to other organs of the body from the gut. And this is actually what manifests as asthma, hypertension, migraines, reflux disease, GERD, hair loss, susceptibility to infection, graying of hair. These are all subtle symptoms, and we tend to push them off, but these are actually the starting phases of chronic disease. The collection of dysregulation amongst millions of human microcosms, each one of us here. This is what actually manifests outside in the environment. And we are actually still trying to find out, is there a cause and effect relationship between what's going on in each of our bodies versus what's going on in our atmosphere around us, right? This is quantum physics. And hence, paying respect to our inner and outer environment at the same time includes nurturing the flora and fauna within us and outside of us. This is actually a very simple approach to explain the reason behind the natural selection of specific populations of the people who are being symptomatic or recovering or dying from coronavirus. What about these soldiers, the healthcare professionals who are dying in war? Well, let's see. So we are seeing many nurses, doctors, healthcare essential service workers getting sick, or some of them unfortunately dying also in the war. And besides the above mentioned risks from having chronic disease, because some of our healthcare professionals also have chronic diseases, right? Like hypertension and so on, obesity, etc. A similar imbalance between the defense and offense actions executed by our soldiers may actually not help during war, right? Because we are trying to find closure to this question as to why are these people dying? Why are these healthcare professionals getting sick? So personalizing the outcomes of patients to ourselves. For example, going on thinking about, why did this patient die? I wish I had done something better, right? So those kinds of personalizations, or even being extremely passionate about stopping the process of death in critically ill patients, puts the defense at risk, right? The mental stress that goes on is really phenomenal here. And so this may be enough for the healthcare worker to burn out. Some soldiers sway more towards self-defense, being very conservative, caution, aggression. And some others, they sway towards being selfless, passionate, uninhibited actions to do their best to their patients, right? And there is discrepancy and all over the world in the distribution of the above two characteristics of healthcare workers. And even each of us have different levels of passion versus being self-defensive at different times of the day. And that's something that we need to pay attention to, because that will help us fight the war better. And so, and therefore, this is why we have predicaments and outcomes. For example, shortage of manpower, and so on. So, and all actions that we do actually govern the outcomes. So we as humans consistently change the mode. Like defense, we go sometimes back on defense, and sometimes we are able to move forward, with which we operate during war. And this can be done effectively only when the soldier balances the use of the mind and the intellect, the emotion versus fact. For instance, there are a few of us in the ICU watching out for soldiers trying to be extremists, too passionate, too self-defensive, and we try to help them to strike a balance. Right. One of the most common examples would be, not being able to eat or hydrate, taking mental breaks for hours together. This disrespect to biological clock within the human body may actually jeopardize the patient life, actually, sometimes from mental, because you can imagine somebody who's not eating and trying to help a patient. Eventually, this leads to stress, and the virus is able to easily infect and cause harm to such healthcare workers. So these principles also pertain, cater to what's happening out in the public, right? Because these are similar instances that happen in your own workplace, in your own professional social lives, where you are trying to burn yourself out, and this is going to affect your health. And this is what ultimately manifests as chronic disease, stress, which is inability to prioritize self-protection versus being passionate and trying to hurry things. So hence, as senior physicians, we made sure our nurses and trainees are taking care of their defense mechanisms very well. And so some of those yin and yang principles that we're using is contentment versus expectations, right? So for example, we help them choose contentment as much as possible in those situations where the defense mechanism is low, as against expectation, because this is the solution to the virus called stress. Because what is the most common reason for somebody to stress out is when they expect something and that doesn't happen, they get stressed about it. So therefore, that's a particular example where contentment is what somebody needs to anchor onto. So we received constant feedback from our healthcare professionals so that we could improve patient outcomes, patient experiences, healthcare worker experiences, because these experiences feed each other. In fact, how matters sometimes more than what we do in troubled times. And we are trying to foresee the psychological and physical impact of this viral stressor on all human lives. And see, the ultimate truth is that time is the only power in this universe that is a witness to this epidemic and has the complete answer to the screenplay that seems like continuously changing as we are approaching this epidemic. And we'll execute common sense more than emotions, and keep open eyes to any clues towards finding a solution to this epidemic, be it the political side, be it the medical side, or the social, economic side of it, and making the experience inspiring. Because there are many people out there trying to inspire each professional out there. Many musicians are making music together, putting it on YouTube, and how you see the EMS people blinking their lights right outside the hospital. That those are small things that are very inspiring, and we appreciate that. Until then, we will take it 1 minute at a time. Be present here right now. We're talking to the families of civilians who have lost their dear ones to this heroic battle, and we are definitely grateful for the love and support we are getting from these families. So here is a picture, right here I'm showing you, is a picture that shows health and immunity, how it is a beautiful balance between duty towards yourself, which includes health, mental and physical health, and then desires, ego and emotions, duty towards family and society. And the balance of these three things is what leads to health. And how do they work? For instance, when you delay certain things, when you harm yourself just because you want to satisfy your desires or emotions, or you want to be extremely passionate about your duty, that's when you may compromise duty towards your self-protection. and that may hamper your immunity and health, and this puts you at risk for infections or chronic diseases. So health is a balance between duty, discipline versus desire. There is a Tamil proverb. Um, it's called Suvar Irundal Dane Chittiram, which means you can paint a picture only when there is a canvas. Metaphorically, you can consider yourself professionally successful only when you have good health as a righteous human. Food and supplements alone cannot constitute as key ingredients to nurturing the gut and your immunity and your entire biology. It is the balance illustrated in this figure above that will sustain health in each one of us. So the individual ingredients include dinacharya or daily routines, which are very simple things, but we actually don't do those things. Ahara, which is sattvic food nourishment. Vihara, which is physical and sensual experiences, which is what we see, what we think, what we do. Activity, going out, experiencing the nature outside, example, and trying to see if we can make the best out of what we have in these times of lockdown. Rasayana, which is supplements from nature, includes neem, cumin, coriander, fennel, fenugreek, black pepper, giloy, and so on. Many, many things in each of your cultures. So it's not just one or two of these that's going to give you health, because I see that all over the internet, turmeric is getting famous, but it's much more than just turmeric, right? It's a whole package, and that's why it's much more hard to achieve health. But at least trying to get a balance between all of these things will definitely help. So I'm going to mention a couple of yin and yang theories here. So number one, health and immunity arise out of a balance between the following opposites: contentment versus expectation, destiny versus free will, self-protection versus selfless, passionate, moderation versus extremism, passionate versus steady and balanced, humility versus ego, action versus reaction, defense versus offense, positive versus negative reinforcement. Here I have just one more paragraph and then we'll be done with this video, which will be the summary here. So various examples from the above spectrum include chronic diseases such as diabetes, obesity, etc., that arise from the inability to balance between the aspects such as contentment, expectation, moderation versus extremism, duty versus desire for actions, such as professional work, being workaholic, high stress workplace dynamics. Your boss expects certain deadlines from you, and you translate the same deadlines to your subordinates. So the entire chain of the hierarchy continues on the same lines of expectations. And this is actually one of the key ingredients towards stress, right? And that's where you start as an example saying, I am focusing on contentment, and that spreads to your colleagues and goes up the hierarchies, where the entire industry becomes focused on contentment rather than expectations. And when the health of the industry is better, then each of its professionals will maintain health. So trying to be an example in your own homes, in your own community, is how we are going to start working on this. So this epidemic is actually a gross form of challenges happening in marital, social, work life, and such times can be hard to focus because of the sudden shock to our commitments and priorities and daily living. We are trying to play this game of life. We are not here to decide whether we are going to win or lose. We are just going to play it, and we need to keep ourselves fit just to play the game. Experiencing the journey, not just the outcome. An ideal soldier in the battlefield, or a doctor today in the ICU, or a general public here during times of depression or lockdowns, focuses on this present moment to only understand the problem in front of him from the ongoing experiences more frequently than emoting on the potential lives saved or lost, for example, by the ICU physician. Similarly, millions of human beings are at risk for temporary unemployment and mental trauma. And we are trying to understand the duties towards yourself, family, nation, and we are trying to balance that with the desire to flourish on earth now and into the future, right? Because it's the survival of the fittest theory. The public and the economy are facing challenges due to lack of customers in their respective industries. This is the time to execute intelligence, to find inspiration from the world around us, to ensure self-protection, survival of the fittest, working with and making the best of what we have rather than expecting. We as humans have evolved over ages past many such epidemics and wars. So our abilities are built into our epigenome, right? This is not the first time this gene has seen this. We have been built for this. And each one of us in our own professional life is actually going to tap our intellect rather than mind to rise up, inspire, and flourish in the midst of this calamity. We do not have to be great to start. We just have to start to be great someday. Um, we're seeing how the public from various walks of life are making the internet world useful to protect their living, trying to make money as much as possible, and at the same time keeping busy, keeping active, doing WhatsApp videos on how to keep exercising and so on, to keep themselves interested in what's going on out there, and to inspire others, executing their duties at the same time and trying to balance them with their desires, even if the outside world is locked down. So what will remain here ingrained in the history of this earth will be how we flourished amidst colossal damage, right? The experience will last forever, and it's for us to choose the two ends of the spectrum, positive and negative, right? Despite all the the conversations that are happening on the entertainment or television, it's for each one of us to be a good example, and that is going to spread in the community. Thank you again for listening to this video. I hope this has some relevance to each of your lives in your own communities and your personal life. And I hope to see you in a different video. I wish you all the best. Thank you.